Diagnosis of epilepsy. I can say there are majorly 4 ways to diagnose an epilepsy. They can be applied to everyone or to some. You could, in our settings, mostly the diagnosis is clinical. If you have convulsions, different convulsions at different times, and these are repeated, it's possible that you can be diagnosed clinically. However, in developed places, or if you have some money, don't hesitate. If they ask you for a CT scan, please do it, because they want to analyze the brain tissue. They want to know in detail where the problem is. They can also ask for an MRI. I know some of these tests are very expensive, but not speaking for the government, but government hospitals have availed some of these tests, and they're cheaper than in private settings. For example, a CT scan can be between 120 to 150,000. So don't hesitate to go and look for government settings that have these scans. We have EEGs. An EEG, like you see this head that has so many wires, that is an EEG. It is not harmful. Recently, I had someone do an EEG. I had never witnessed one, but it's actually a very peaceful procedure. Even if it's for a child, they will induce them to sleep. There is no agitation at all, so don't be scared. These are some of the pictures. For example, the upper one, it's an MRI, someone going through an MRI machine, and the CT scan is almost similar to that. The downer one in this corner is just a result of maybe a CT or MRI, and then this is an EEG. Treatment. Friends, there is hope. If you have your patient, if you have your son, your daughter, yourself, there are treatments. The earlier you start these treatments, the better the prognosis. Like I said, I did my study in epilepsy, and from so many testimonies, many of them told me that when I was taking my drugs, I'd reduced from the so many numbers of convulsions in a day to maybe 1 convulsion in a week. Some of them actually take months without having convulsions if they are on their medication. The challenge comes when they are being forced into religious beliefs that, I've healed you, you don't need to take your medication anymore. These people relapse. And some of them had gotten the hope of getting cured completely. Some of them had reduced from convulsions in a day to convulsions in months. However, if you mislead them with herbs, you mislead them in churches, these people, you're compromising their health, and you're not going to pay the price. It's them and their relatives to pay the price. So guide these people well. These people can continue with their spirituality, but continue with their medication. Whatever herb you have, I'm not here to preach herbs. Don't take these people off their medication, because there is hope of cure. But even if there is no hope of cure, most of them have reduced episodes of convulsions. So take your medication and adhere to it. In developed countries, they can perform surgeries and the affected part is removed, and these people get cured completely. Some people have brain implants. Like I said, these are developed countries. In Uganda, I can't testify to this. Maybe they are there, maybe not. But in developed countries, people have a number of options to approach these epileptic episodes. I want to thank you for watching. Next, we are going to look at what everyone must know about epilepsy. Like I said, this information has been packaged for a lay person. So don't say you're not a medic, so you shouldn't watch this. It's for a lay person. Thank you for watching, and thanks for subscribing. If you haven't clicked that subscription, just click it. Bye-bye.